Right. Welcome, everyone. Looks like we're live. Welcome, 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 everyone. While we're waiting to give people time to arrive and get linked in, we'll ask our panelists to mute yourself until we open up our dialogue. Um, and then we will ask our those who are joining us to go ahead and share with us where you're joining us from. This kind of helps us get our juices flowing. We like to see how many ways we can connect with folks who are joining us today. I happen to be coming to you from Ohio this time, the Buckeye State. I think the last time, because this is our second diversity roundtable, I think I was in Kentucky. It doesn't look like I can sit still, does it? All right, so in the event that, as I said, as we're waiting, there are a few housekeeping rules or housekeeping things I'll take care of. We're waiting for folks to join us. Again, feel free to tell us where you're coming from. Share that in the comments. This is a live stream and it's intended to serve as an educational experience or educational content. It is not intended to replace therapy. So, for treatment related questions, please be sure to work with your local provider or contact a local clinician. Now, today we will have clinical representation, but again, our clinician is joining us from an educational standpoint. The International OCD Foundation is not a crisis hotline and should not be used as such in the event you are in distress or feeling unsafe. If you are in a crisis or you ever feel suicidal or feel unsafe, please go to your local emergency room, call 911, or you can use the suicide prevention hotline at 800-273-8255. We also want to make sure that we're creating a safe space for all of us joining here today. So that includes us being kind and respectful. With that, this is being broadcast on various social media platforms and is being recorded. So please be mindful of that as you're asking personal questions, as you're sharing personal experiences, or as you're leaving comments. At the end of the day, we're all here to support one another. So let's go ahead and get started. As if we hadn't started already, right? Welcome everyone to our IOCDF Diversity Roundtable. I am your moderator, Dr. Darlene Davis, and this is our second Diversity Roundtable. If this is your first time, we look forward to your participation. Please use the comment sections to share your experiences. We like to put comments up on the screen, so make sure you, again, feel open and free to share. If you are joining us again, we welcome you back, and we want to make sure that you chime in. In line with IOCDF's mission of fostering a hopeful and supportive community for those affected by OCD and the professionals who treat them, I would also add family members and loved ones of those affected by OCD. I welcome you to today's roundtable discussion on creating safe spaces. With our solid foundation and the mission to foster a hopeful, supportive environment and our plan to really engage in this diversity roundtable, I would like to give you kind of a premise or a framework, okay? So the goal for this diversity roundtable is move beyond traditional diversity discussions that center awareness. So what is that? That means we're not here to just share information in the traditional way. This is what race and ethnicity means. This is what cultural competency means. We're moving that needle a little more towards action. So we're here focusing on how can we make change. We are very, very aware of a lot of the problems. If you've been living in America over the last year, a lot of things have kind of boiled to the top. So today we want to have this space to talk about creating safe spaces and put some things into action. So we're here about change. And so in doing so, we will honor the following agreements. Number one, we want to hold a space where differing perspectives are respected. Number two, we want to model effective ways to have difficult dialogue around topics of diversity. That includes differing perspectives. We are all very different. Even if you just look across our panel right now, we all look different. And so because of that, we know that our lived experiences will be different. And we want to have this space specifically for that. And then the last thing is we want to then, after we've approached this topic, we've engaged in this dialogue, we want to take action steps towards enacting change. And so with that, again, that solid foundation of what we're looking to do, I believe it's time for us to get into our discussion on today's topic of creating safe spaces. I would now like to bring to you, if we have a decent number of folks here. I see somebody from Seattle. Hey, Rash Crafty. That's really, really far away. You're actually a couple hours ahead of us. I would like to now bring to you our panelists, and I will call you out as I see you on my screen if that's okay with you all. Okay. All right. So our panelists, we'll start with Waylin. Waylin, you mind telling us your name, your role on the panel, the identities that you feel comfortable sharing, how long you've been engaged in your work around creating safe spaces, any things that you feel is interesting or relevant. And yeah, we'll start there. That sounds like plenty, right?
Yes. So my name is Waylon. I'm coming over from Chicago, Illinois. I'm currently in my third year of a clinical psychology PhD program over at IIT, working on studying things related to OCD, hoarding, anxiety, and things of that nature. And so in terms of my role on the panel today is to represent Asian American communities. Well, I guess specifically Taiwanese American. I obviously can't embody all of them, but yeah. So Taiwanese American, but then also the graduate student perspective in terms of various academic spaces. So things like the programs more broadly, but also experiences at practicum sites and various other academically related places.
All right, well, and thank you. Thank you for being with us this evening. And I'm absolutely, as you saw me go like this with the degree, I still can relate. I've been away from my program quite a while, but there's nothing like, I think you often are triggered and relive a lot of these experiences. But I'm super excited to hear your perspective and hope you feel comfortable in this space.
Yes.
All right, we'll go with Jelani. You're up next.
Hello, my name is Jelani Daniel, and I too am a third year within a doctorate program, a PsyD program here in Houston at University of Houston, Clear Lake. Actually, prior to being in this program, I've been a licensed professional counselor for 6-7 years. Prior to that, just been in the field around working with people struggling with OCD and anxiety for quite some time, since 2005. So I bring at least some of that clinical perspective with my experience in that regard, as well as perspective from Black American and particularly a Black male, and I think that's about it.
Awesome. Thank you, Jelani. I feel you. I feel the stress. And I hope you feel safe. And as a matter of fact, you can too speak to your experiences there. I know we brought you in the clinical space, but to have that overlap, I think, is a very unique opportunity, right? To both serve and function as a clinician, but then also find yourself in an academic setting. And we know, just in the field of, if you're a researcher, that sometimes, there's a gap there between like the research and the clinical work. So I think that would be a very unique perspective to have if it ever comes up.
Sure.
All right, and we have Alexandra. Do you have a preferred name?
Everyone pretty much calls me Alex. That's what I usually go by.
Alex it is.
Yes. So my name is Alex, or Alexandra, and I am a stay-at-home mom currently. I did graduate from Kennesaw State with my Bachelor's of Science in Psychology. And I am extremely passionate about both women's rights and mental health. I was a domestic violence victim advocate for many years, and I've been in kind of the space of creating safe spaces and social justice for about 20, maybe 22 years now. I am Latina. I'm Puerto Rican, first generation, so I can represent both the Latinx population and OCD sufferers, as I have had OCD since I was about 6 years old. Probably before that, but that's what I remember.
Yeah. Wow, talk about the many hats, the many lived experiences. So you were like a perfect fit. Thanks, Steph. She can hear me, I'm sure. Steph brought you to the panel, so I'm very appreciative for that. So again, just like I told Jelani, feel free to speak up on any of these experiences. You have a lot of lenses that I think are very valuable, and it's very unique, and it's very important to be able to hear about how those either inform each other, how they can conflict, right? How they might overlap, because all of that's how people exist in the world, right? We're not just one thing. We're often dealing with very, very layered, very nuanced experiences. And so I think that's what makes this roundtable so a great opportunity, because we're not just dealing with one layer, one aspect of diversity. We're dealing with gender, we're dealing with race. No, we're talking about lived experiences in all its complexity. All right. Thank you, Alex. I appreciate you being here tonight. All right, Olanike.
All right, welcome. Good evening, everyone. My name is Olanike, last name Ayemini-Mensah. I am the CEO and founder of equity consulting firm called Mosaic Consulting. My identities are also complex. I am Black, I am a woman, I am ethnically Nigerian, I am a first generation American, so I have an immigrant perspective to my identity. And I'll leave it there. I could go on. I'll leave it there. And, my perspective to this conversation is that my work as a equity consultant and as a leadership and management coach is very intertwined with human behavior. And creating safe spaces in workplaces and in other settings. And so what I have found with my sort of intersectional perspective and identity is that so many things that happen with human beings in one place are transferable or, happen in a different way in another setting. And so I'm here to, lend my experience, my lived experience, as well as any sort of DEI related themes that may be applicable to the conversation today.
And thank you, Olanike, for sharing once again, all of your lived experiences. Now, Olanike and I know each other from undergraduate school. We both attended a historically Black college or university, go thoroughbreds, Kentucky State University. And so she's here because of all of the layers that she just described, right? The immigrant perspective, because there's an assumption that Blackness exists across the globe, right? And it's the same. And I think we talked a little bit I know that I've facilitated conversations on that across different panels. But for you today, I think it's super important because this is about action, right? We are clear about some of the problems we have. We are clear about some of the barriers and challenges we have. But we are here to discuss action. And so as a DEI professional, that is literally what you do. You come up with plans of action. So hopefully you're able to take in some of these lived experiences across the folks who are with a part of our ILCDF communities as sufferers, as in the academic setting, as researchers, graduate students, and clinicians. And you can piece together and offer some suggestions from your lens and experience. And so for those of you who are joining us for the first time, I am Dr. Darlene Davis. I'm a clinical psychologist and I'm the moderator. And I am also a researcher who treats OCD and related disorders in youth, young adults, and adults. I have over about 15 years of experience in clinical mental health. I've gone through the trenches of completing the PhD at the University of Louisville, completing specialized training, conducting research, and also publishing works on culture and OCD specifically. I specialize, and I think this is important because, again, it kind of follows this theme. I specialize in treating OCD and comorbid disorders, right? So if you've been in our field a while, you know that a lot of the treatment approaches are very linear and that they attempt to attack the OCD. But we know that, and we're constantly learning that OCD is a very complex thing. So it shows up with depression. It shows up with substance use disorders. It shows up in where my area of interest is racial stress and trauma. So that's where I like to just hang my tassel in the space of providing and improving access to quality mental health treatment for African Americans, Black Americans with OCD and confounding racial stress and trauma. So before we kind of hear from our panelists and get this conversation going about creating safe spaces and answering the question, and this is the question I posed to them, is this a reasonable ask? I would like to offer the viewers a very helpful technique specific to your engagement in this roundtable. I challenge you as the listener to, as the panelists are sharing the wealth of information and experiences they have and their valuable perspectives, it might help to listen for maybe one new thing from each panelist that you didn't know before. Okay, So think about how that could work, because you're going to get a lot of stuff coming at you. All right. So now let's hear from our panelists. And as I know I directed you all before, but you all four of you, just feel free to just kind of chime in as you see fit. We're talking about creating safe spaces. I asked you before, is this a reasonable ask? Are we expecting too much given the social climate we are in today? So the first question, that's our premise, like that's our umbrella, and we'll kind of move through that for the remainder of the time we have together. But I would like for you all to start with, what are safe spaces and why are they even necessary? So you all chime in. You're up. Tag, you're it.
Okay. Alex, you want to take it first?
Go ahead.
Well, I'll kick us off here with a broad response. I think that a safe space is one where everyone that's in that space feels an adequate level of psychological safety to be there, to be present, to be authentic to who they are, to navigate conflict in that space and still feel whole during and after that conflict. So those are all the things that I think about when I'm thinking about what a safe space is. And there was a second part to your question that I lost, but that's...
Why are safe spaces necessary?
I happen to, from my personal lived experience and professional, to have experienced that when we're not able to have all those things that I just described, it actually has health, not only mental health, but physical impacts on our physical health impacts. So I think they're necessary so that we can be whole human beings.
Alex, it looks like with your 20 years of experience of creating these safe spaces, look like you want to just add all the niceness around Olanike's answer. So like you got plenty to add, yeah?
I do.
Let's go. Open the door.
So I think, sort of like I said earlier, I believe that a safe space is not just a culturally sensitive place or an accepting place, but it is an affirming place. So it is a place where we hold space for each other and we listen more than we speak. And when we hear something that we don't understand, we go and educate ourselves and then come back and bring that to the table. Because it's not just about making someone feel comfortable or welcome, but actually affirming their entire identity. I think safe spaces are necessary because when we move in and out of spaces that are not necessarily, safe, we need somewhere to go where we can rest. We need somewhere to go that holds us and affirms us and allows us to relieve that trauma that we have experienced elsewhere.
Wow, that is so... I'm sitting here listening and it's just all settling on me in a very heavy way. And I don't know if it's because I'm being triggered, just like I'm going through all the times and experiences where, I can think of where I didn't have a safe space. And then also on the flip side of that, I did have a safe space. Anyone else have anything to add?
I think even just considering from the clinical perspective, if one doesn't have a safe space, then I think it doesn't allow someone to really have the ideal environment to be able to heal, to be able to recover and to grow. So providing that safe space, for someone to be able to allow themselves to be vulnerable, to be able to open up, to be able to explore, discover, because without that, then if someone doesn't feel safe, I imagine, someone's more inclined to stay withdrawn or stay within, stay closed, stay guarded, which definitely doesn't allow for, optimum growth and development if they're not feeling safe.
Yes. Waylon, no pressure.
No, I was just gonna add, I think, I think a safe space can be as Alex was saying, kind of that affirming piece is really important, especially if you're thinking about different clinical or academic spaces where if that support or safety isn't there, that you can really impact people mentally or emotionally how they're feeling. If they're feeling unsafe, why would they stay in a program, right? Or why would they stay at a training site? Or why would you stay on as a client or patient? Something not feeling safe in that way with your provider.
And I think you just close it out perfectly. And I'll tell you why I think that. Oftentimes when we think about safety and safe spaces, we think physically, right? We think about a room, we think about a building, we think about our own physical safety and security, right? If I'm walking down a dark alley, somebody's going to physically hurt me. But you all mentioned psychological, Olenike opened up with it, psychological safety. And then Waylon, you close with emotional, right? So these are the things that help us answer the question. At least for me, I posed the question, but obviously it was an easy answer for me. Are we asking for too much? Is this a reasonable ask? Was the exact question. Well, in this area, in this field, in what we're doing and what we're discussing, we're talking about safety, right? But specifically emotional and psychological safety. So that's where we find ourselves, right? And I think there seems to be a theme, right, of this halting or stunting or stopping of growth, recovery, right? Like we're here to move things. We're here, whether it's our progress in our program, whether it's working with the client individually, right? Whether it's our own growth in healing. I need to know, like it is important for me to know that the identities I bring into the space are affirmed. That's the magic word. Thank you, Alex. Thank you. Someone else said it, I believe too. But all of the words that I'm pulling from you all is the message. It's emotional, psychological safety for affirmation to move us toward growth and recovery. It's action. It's action. So now that we've kind of laid that foundation and we get it, let's share more about your own personal experiences and perspectives, okay? And again, hopefully you feel this is a safe space. What safe spaces have you felt like you benefited from in your area of representation? Look at you all. I see like a couple of you looking up, and then so I'm gonna. Part of me is like, okay, have you all not had that many experiences? Like,
I'll jump on it.
Okay, so then let's speak to that, right? Like that's because my other question is, what areas of growth still exist in your area of representation? So my initial question was the assumption that you had found safety somewhere, but let's talk about if you haven't, because I think that's as valuable as well. So does that help loosen it up for y'all? Because y'all were like, the emoji where you're holding your head like this. Like, I think I have.
I think there's almost a duality to it.
Okay.
Especially with my perspective of being first generation. So my family tends to be a safe place. We come from a collectivist culture where there's a lot of wonderful stuff, and there is also a lot of machismo and marianismo. So a lot of kind of toxic masculinity and toxic femininity going on, which can feel very unsafe. So I have to pick and choose when I'm moving in and out of these spaces. Well, how is this going to be? How am I going to interact with this group of people, my family, to be safe and then get my other needs for safety met elsewhere, like with my friends or my loved ones or my husband. Same thing in mental health. I would say that I feel safe with my therapist, but I have also had experiences with other therapists that were very unsafe, whether it was because they were racist toward me, which has happened, or they were dismissive of my cultural needs and my cultural considerations as invalid or less than theirs or silly, or people dismissing my symptoms or my pain because I am a person of color. I've had that happen as well.
That's very heavy. And I like to your point, the duality, right? Like you have spaces where the assumption is, well, of course I'm going to be safe. I'm talking to a therapist. Why? This is supposed to be where I'm supposed to recover. I'm supposed to get better. So why would I expect something different? But in the same breath, on a more social, more personal level, family, right? Like sometimes family, to your point, create very safe opportunities and experiences for you, but they can also contribute to some of the toxicity you experience. Great, excellent points, Alex.
Yeah.
Excellent.
A lot of that I really resonated with, also as a first generation American, and having a lot of safety in family gatherings, but I would probably say more so in my sibling group. That's probably, if I had to narrow it down and pick the one place where I'm not filtering my thoughts, I'm not filtering what's coming out of my mouth out of, like, is this safe to say, is it safe to be 100% me? It would probably be with my siblings, and that's it. However, I do think that I found a lot of safety in other pockets, even if it wasn't 100% safe. One of the stories that I share is being, when I was born in the US, my family then moved back to Nigeria when I was about 2. And moving back to the US at 10, I had to sort of learn all the reasons not why people that look like me aren't safe in this culture, right? And it wasn't until I found myself on the campus of the HBCU that we referenced earlier, where Darlene and I met in undergrad, that I felt the closest thing to safety on that campus that I had felt when I was 10 years old before we left Nigeria, right? I was like, oh, whew, it's just us here. This is nice. It's like I don't have to worry about certain things while I'm here on this campus. And so that was a very surprising experience to go through, because I wasn't looking for that when I applied. I didn't go looking to go to an HBCU. Many people do. It wasn't a thing that I'm a first generation American. My parents didn't know about that. And so I just sort of ended up there, and then I got there and I was like, why does it feel so good here? Oh, that's why. So yeah, I have a lot of resonance, Alex, with what you shared, but that's an example of a place where, for my life story, I felt a really huge wave of safety on that campus.
I think for me, I resonate with a lot of what has been said already. And I don't know, it's an interesting question. I'm still having trouble trying to pick one particular experience or whatnot. But I think for me, quite honestly, I feel like with colleagues and in a type of environment and setting out such as this, I've actually felt as though I found this to be a safe space, and just being able to meet people with shared experiences within the field. Also found that within classmates and going through the struggle of, going through class together, and people who I've just been able to really identify with. And even then in the clinical settings, also again, colleagues that again, who can identify with my experience, and we share, whether people of color or not, at times can feel safe amongst them. Certainly, I think there are times within any of those settings, whether academic or clinical settings, where have not felt the most safe, or have not felt as though my perspective and culture was considered or respected. And also, I too identify as a first generation American, as my family is from the Caribbean, from Grenada specifically. Oftentimes it's assumed that even actually growing up, it was always assumed that my family was generations within America, and that I'm a typical, I guess, whatever often be stereotyped as as someone who grew up with the same sort of cultures and values. And it's like, no, my food I eat is different from maybe other Black Americans down south.
Yes.
And where I'm from. It's like,
yes.
where I know a lot of people eat chitlins and stuff, and
Yep.
I grew up eating curry foods and roti and things like that. So get a little bit on a tangent, but just getting into the point of which at least just these cultural perspectives and diversity perspectives that were important to me, and at times in which I felt safe and at times which I didn't. So
I want to jump just right on the end of that last little part that when you really start like really connecting with you, like I saw you, right? When you were like the roti and like that's the part that makes it very important. Like this is when you know you have a safe space, right? What I just literally observed with you were like, yeah, this is kind of like, what we were doing and this is what I'm thinking. And then you like shifted to and the roti, right? Like I'm serious. This platform, you just showed exactly what I was talking about. Like we unfold, we test. When you share certain identities that are marginalized or oppressed, you start to test how safe you can be, right? And as you're getting comfortable in this space, just kind of as you're thinking through that experience, you're like, oh yeah, that thing. I want to bring that to the attention of the audience because that is what you expect to see in any of the environments that you're in, whether it's in your job, if you're supervising someone, whether you're in therapy and you're holding their treatment plan, you're facilitating it, right? From a clinical perspective, like in your lived experience, in that safe space that we're talking about, and we're just socially engaging, that's what you expect to see, especially in an academic setting. Because again, for me, in my lens, is me, Waylon, and then Jelani at the top. So we're all like, I'm just like, especially in an academic setting where you're constantly second guessing yourself. You don't think you're worthy of anything. You're critiqued like every 5 seconds, right? And so to be able to just exist as you are and to have your existence be respected and validated and seen and observed, right? It's that. So if anybody's curious as to what it looks like when someone feels safe, you just observed it. At the end, as he was coming out, he was leaving out like, hey, I'm Jelani. Yeah, the grenading kid. Yeah.
And isn't it both? Like, I think that can be a conscious thing that we're doing, but a lot of times it's not conscious.
Yeah.
We're not thinking like, oh, let me withhold a part of myself and not tell you. It just sort of naturally flows, right?
Yes.
Right.
Yep. You're testing. Absolutely. Alex?
It resonated for me because I think that when you feel really safe, you kind of feel like you can come out with all these other parts of your personality, especially when you are accustomed to being the token or the representative of your culture, right? And so you get lumped in as the Latinx do and the Hispanics as this one person is going to be the representative for all of us. Well, there's so many different cultures within Latinx, within Hispanic, within, African American, Black American, Asian American, and we don't get to express that. We don't get to talk about ourselves. I'm Caribbean too, and I eat plantains and rice and beans. I don't eat tacos, right? I will.
It's a plantain.
But we don't get to talk about those. And when you are in a safe space, that is something that you are supposed to allow everybody else to be is themselves. Right. Those fine details that make a person, a culture so beautiful. We shouldn't be just washing over it, and saying, well, we're all the same because we're human. Yeah. No, our differences are beautiful. Our brains, neurodivergence. It's all beautiful.
Yes.
Yeah.
And one other thing I wanted to point out, I think that you all have also been raising, I think when we especially talk about identities being affirmed, I think it also goes to like the difference between diversity and inclusion, which tends to be like words that are very often used interchangeably, but probably not accurately in the sense of like believing that they're the same thing. But like diversity, of course, is going to be like including people of all different backgrounds and, different genders, sexual orientations, race, so on and so forth. But inclusion, I think that's where it gets to the aspect of like affirming and like letting everybody's voice be heard. So like including everybody, not just having everybody just like being that token, because you can have a diverse group, but like people just be tokens. Oh, okay, you represent this group, that group, that group. But instead of just being that, it's like being a part of the team, like including so that everybody's heard and feels affirmed and feels accepted for who they are. And so I just wanted to touch on that because I think we've been bringing it up, and oftentimes diversity and inclusion get mixed up.
I feel like McKay, like he just paved the way for you. But after Waylon, though, go ahead, Waylon.
I feel like a lot of these things can end up being internalized too in a lot of ways, where we were talking about inclusion from the perspective of not including everyone in the same group, right? Where I think even in the beginning, I lumped myself into, you know, the Asian Americans when exactly we were saying like not all Asian people are the same, or, you know, things like that. And I think being Asian American too, like part of that larger community, is an interesting place to be when talking about race and culture and things like that, because I feel like we're kind of in this like weird, not really like middle place in a way, where it's sort of like there's this whole thing with the model minority, which I didn't know was a thing until I thought about it or learned about it, right? And so maybe historically there's this image of feeling safe, right? Where maybe you didn't question various things, you're just like, oh, you know, whatever. But then as you learn more about that and learn more about these various discriminations or racially related things, you're like, oh, maybe I wasn't as safe or not oppressed as I thought I was, you know? And so it's this weird place like in between things where you're like, I'm not real, but then you know, but so,
and I feel like you're right, Will, and that exists. And I think that kind of came up a little bit when Jaylani was talking, when he was like, he didn't outright say it, but I was picking up as a Black American, like as a African, I say I'm Black, but African American would be the term that most people understand, compared to Nigerian American, right? Compared to, do you say, is it Grenadian? How do you say that, Jelani?
Grenadian, yeah.
Grenadian,
or West Indian. West
yeah,
Indian.
right. So like, we're all brown faces up here. We all speak English, right? With McKay has like a slight accent or whatever, but like, there is like so many differences amongst us, just us three. Like, so it's crazy. And it's not just food. It's not just tangible things. It's our perspective on the world. It's our beliefs, is our interpretation of like different experiences here in America. Like, these are all very different, except we even get used to lumping ourselves. Just like you said, Waylon, we're like, oh yeah, we're just, you know, we're just Black over here. It's like, no. And because that's part of being just kind of just used to this system. In the same way that I said, like, yeah, I'm Latinx, I'm all of us over here, right? She's Puerto Rican, but like even Puerto Rican, I know, just having lived in a different part of the country, that's different depending on so many variables, right? And so that's the reason for the safe space. And as I'm listening to you all talk, I just hear it just keep building and unfolding. And I go back to my original question. Is this a reasonable ask? With all of these nuances and all of these little pieces, how might one go forward creating a safe space when you never know what you're creating? How do you do that?
I know. I want to be difficult and say, I don't care if it's reasonable or reasonable. Like, we just got to do it. Period. Because the alternative is to leave it the same, and to leave whatever these spaces are, to leave them functioning to only work for some people, to those that have been historically included, and to leave it not working and not being safe for everyone else who's been historically excluded from whatever the space is. And so, you know, there's something that I talk about a lot when I'm in my work with like workplaces most of the time that are doing equity work. That I try to really get them to shift their mindset to the way that they solve other problems, you know, the way that they address other issues, which is like, there's a problem, let's assess it and analyze it in this time frame, and then let's come up with solutions, and then in a couple of years maybe we will have solved this problem, right? That's not how diversity works, because for DEI work, diversity work, inclusion and equity work, you're dealing with people. And you're dealing with things that have been embedded in our culture and society and our institutions and workplaces and communities literally for centuries. And so you have to commit to an iterative, ongoing practice. and continue to assess and reassess and continue to apply solution and strategies and upon strategies. It has to just be part of your ongoing work. It's not a one and done sort of activity or exercise. And it does require a lot, but the alternative sucks. It's not working. No one is growing, no one is healing. It's causing more harm. And so if we say that we care about each other, we care about our communities, we care about our workplaces, we care about our colleagues, then we don't really have a choice. So, I mean, I guess it depends on what your definition of unreasonable is. I say that it is reasonable. You just got to figure out how to do it and be committed to the work.
Always me. Sorry. So no, a lot of that, it really resonates. And I don't think it's unreasonable. I think that it starts on an individual level. And then when we speak, we hope to inspire others. And the more small, safe places we create and the more we connect with others, then they hopefully will build out safe spaces. And of course, we need education to be taking these conversations into schools when children are young, or to youth groups, wherever we are able to have these conversations as ongoing, not just a one-off training or a 1 month training. It needs to be a constant conversation so that people are inspired to open their eyes, hold space for each other, and just appreciate the beauty in difference. Because when you boil it down, to me, it's not that difficult, but it is hard work because you have to put aside all your bias and just be willing to really listen and see the human being that is in front of you for what they are and accept them. It sounds easy, but it's not.
And I think there, in your point, and Jelani, I see you just no, stay on mic. You're going to come up next. I think the thing that stands out that both of you two agree on, as you shared, is that the one and done training matched with its ongoing work, right? That's just going to cancel it out. So, right, that whole cultural competency training, like I'm all of a sudden culturally competent because I took my multicultural diversity class. Or I got my CEU that time, and now it's just like, oh yeah, I'm culturally competent. To your point, it's in holding the space. That space exists in colleagues, one-on-one basis. It exists in the therapy space. It exists in the supervision, mentoring, academic space. It exists in our business interactions, right? This is what can be done. Commit to the individual space. Because yes, if we looked at it as a bigger picture with all that's going on in the world, I'm gonna agree. Like I would be completely overwhelmed. Like this is just how do you take down an elephant? Oh my God, there's like 1 gazillion gamillion. Yes, I made it up. That's how many elephants is in a room right now with us in America. That's literally how many elephants. So we're not taking down any elephants, y'all. But what we can do is agree to hold space for each other. Go ahead, Jelani.
I was just going to add, and kind of going off of what Alexandra was mentioning, is I think, and just coming from like a clinical perspective again, I think one thing that is really required of us as clinicians in creating safe spaces, allowing ourselves to be uncomfortable. Like this is not something that's going to be easy and or whatnot, or being able to do things even when we're not the most familiar, not the most educated, but being willing to experience that discomfort, being willing to learn, being willing to make changes in order to create and facilitate more safe spaces. So I think, that's a big requirement of us. And especially if we're asking clients or others, for them to be uncomfortable in these situations, that we need to be allowing ourselves to be doing the same, of moving and leaning into that discomfort so that healing and growth, discovery, progress and whatnot can occur.
I honestly think it positions us as clinicians and helping, just generally in the helping professional. Like, just generally think across the helping profession, right? Like all of them. And we find ourselves holding, as you said, Alex, we find ourselves holding spaces for those we're working with. That's exactly what we do. We hold it until they can take it over, right? That's essentially what we're supposed to do. Should I say it that way? Like, that's what we're trained, that's what we're encouraged. That is, so we are nicely positioned to practice this as clinicians in this IOCDF community, because we get to witness the distress in treatment, and we sit in it with them, and we hold it for them, right? And then we give them the tools they need to navigate that, right? That's literally our treatment. Somebody stop me if I'm wrong. Am I leaving anything out, Jelani?
No.
Okay, I didn't think so. I think I'm pretty good at it sometimes, right?
You ain't said no lies.
So if that's what we are already trained to do, then I think something Olani K said earlier is like, people as humans experience things in one place, and then they don't realize that those, like, that like it transfers over, or something happens where it's like there's something about this space over here. That's what we can do in this community. We're already used to holding distress and discomfort in all of our seats, whether it be in academia, whether it be clinically, whether it be as those walking around healing and recovering from OCD. We're used to it. So if you think of it that way, it's not that unreasonable, is it? Like, you kind of already got some stuff already in your toolkit. You just didn't know that you could apply it there. See, because that's my motto with therapy. I like to like show people like, hey, you didn't even know you already had a framework. Let me show you that framework. Let me show you how it worked for you. Now we're going to pick it up and move it over. And then we're going to have to adapt it a little bit to fit over here, because it's just not like a matchy thing, right? But hey, there's a lot of nice structure over here that we can use. And then the things that we can, we'll just tweak it a little bit. Hey, IOCDF community, we already have some really decent tools already in place. So is it unreasonable? Is it reasonable to ask such of our community? Of course, because we already have tools. Have we probably ever thought of it that way? No, that's why we're talking about it. To Alex's point, that's why we talk about it, because we would have never arrived at this aha moment. Like, oh, we have this. And then with that in place, right, as we start to build up our confidence around, hey, I didn't know I had that. Now I can go up my hierarchy. Now I can actually start talking about race. I can use the word racism. I can use it. I can use the word racist. See, nothing fell apart. It's all still together, right? Like, we're all still here, right? All the things that we avoid, even on this panel, we were like avoiding like a lot of phrases and statements. That's just because it's our natural instinct, right? We're trying to test things out. Holding these small spaces, as Alex said, creating these small spaces where we're testing things out in safe spaces allows us to then expand our groups. We get to take it in larger groups. We get to take it in different settings, right? What do you guys think about that?
I was thinking about the distinction between safety and comfort, actually. Because when in my work, in my walk through life and my profession and everything, the concept of a safe space, I encountered first and for many years, and still to a lot of extent, in like workshop group discussion sort of settings. Like, let's create a safe space. Let's talk about the rules for having a safe space. And really, when you're not naming those difficult things, when you're not naming racism and the injustice and inequity and whatever baggage people are coming into the room with, those agreements that people make when they're talking about safe space kind of just default to being safe, or actually it goes beyond safety. It goes to not only being safe for a particular profile of participant in that group, depending on whoever has been the dominant, the identities in whatever the space is, historically. It also works beyond safety and is actually about keeping them comfortable, right? So I think a lot about the difference and the distinction between we're all safe here, versus we're all comfortable here. And I'm curious how that comes up for all of you in your work, because that's something that I feel like I'm constantly having to tackle. And, you know, in DEI sort of facilitation work, a lot of people have moved away from actually even using the term safe space and referring to it as brave space. And there's like a whole lot of stuff around how people define that and talk about that. So I'm really curious from all of you, how that, if that distinction resonates at all.
That resonates. That resonates a lot. I think that typically, in my experience in work, in advocating for women who were immigrants, documented and undocumented, as well as Latinas, people wanted to be able to feel comfortable while feeling like they were being diverse. So they didn't want to have to challenge their notions or their biases. They just wanted to feel like they were doing something good. And, you know, it's that whole, what they call that, the white savior complex. I'm sorry, I went there. Okay. And I'm probably going to go there again.
Please don't apologize. That completely negates everything you just put forward, right? Like we're thinking therapy, right? It's like saying, but I like you, but no, there's and. So we're honestly practicing what Nikkei just brought up which is a very important point. And before you continue, I'm going to anchor it for those of us who are listening. When we're doing therapy, we have people name their OCD. Do we not?
Yes, we do.
Okay, right. So if this is the framework that we agreed upon, then let's name what it is we're working through, right? Because if that's your personal experience and what challenges your safe space, the white saviorism, then that's something that we want to honor in your lived experience, okay?
Yeah. I mean, absolutely. I think when you're trying to move in and out of these different spaces to help people and advocate for them, whether it be as a domestic violence victim or a sexual assault victim or somebody with OCD who might be a person of color, we have to navigate all these different expectations and biases and almost appeal to this white savior complex in order to get anything done. And that is what's frustrating. That I think that is the framework you were speaking about. And we have to smash that framework. That cannot exist. And for that to not exist, people have to get uncomfortable and listen.
And name it. We have to name it.
Yes.
To Olanikei's point.
Action
if
items.
You're treated OCD and you allow it to stay over in the corner, it just keeps getting bigger because nobody wants to name it. That framework, if we're agreeing, at least amongst us, if we're agreeing we're using that framework to at least get some action going here, then we got to be able to name it in certain spaces. And so this is also a safe space to have an alternative perspective. So if anyone has an alternative perspective that says, well, no, sometimes comfort is best, then let me know. I want to hear that too. And so that's my little spiel. So does anyone else want to speak up and answer Olanike's question?
I don't know if this would specifically match on to what she was saying, but I think it was something I was thinking about in terms of ideas of comfort or discomfort and kind of challenges of creating more of these spaces. I think both in clinical, but also in particular in academic settings, is this idea of the power differential that is often named, right? Not so one is the academic space, right, where I think even when you have faculty asking for feedback, it can be challenging as a student to be like, oh yeah, because we've had people ask and most times people don't answer for various reasons, right? And so I think we had a couple of people who did speak up, but broadly no one, said anything. And I think that can kind of also translate a little bit to the clinical space too, right? Where often people name that power differential between, a therapist and a client, right? But then you have people who adopt more of those feminist theories of therapy, right? Which kind of aims to take away some of that. But then I think a lot of people who follow that kind of traditional lens with therapy is like, no, you can't talk about your identities, you can talk about yourself, and there's these divides. And so I feel like it can be a challenge to think about how that idea of power or power differentials kind of plays a role in some of this.
What would you recommend? Because I think, first of all, the bravery in speaking to that and naming it, right? Because that's a real thing. So that was absolutely my lived experience, right? You don't, if you want to get through this program, you make sure you keep your head low because you're trying to get finished. Let's just be real. That's what it is. And you're going to do all the work and you're not going to get any credit. And that just is what it is. And I'm laughing uncomfortably because it's true. But to that point, so what do you recommend, right? If you're speaking to the faculty persons who are listening, if you're speaking to early career professionals, right? Because, those folks are very open to, they're closer to that experience. So they're more likely to shift a little bit, right? What do you recommend? What is your action item? What do you say?
Yeah, I mean, I think from various perspectives, I think on an individual level, maybe thinking about being more uncomfortable or being more brave, where I know absolutely there are people, in my program or various programs who are willing to speak up about those things. Whereas for me, I'm somebody who tends to shy away from those kinds of things. And so I think taking a more active voice, I think is one thing to kind of reflect upon and implement. I think more broadly too, I think for programs to think about, and I think some programs are already adopting this too, is a model that is more scientist practitioner advocacy or activist models. I know one program over in Boston is doing that. And I had sent my program their handbook, and I, apparently it's being incorporated into various thinkings of our program, which is good. But I know over in that program, they really do foster a lot of these safe spaces and dialogues where it's kind of creating a more clearly kind of like junior colleague relationship. So that kind of eases some of that differential a little bit. But also I remember even in their interview day, they had it wasn't just like a diversity panel, but they also had a student of color or like interviewee of color, like additional meeting. Where I had faculty members also reach out to me to be like, if you need support around any race-related things, we have women of color here who can support you. And I'm like, you don't even know me. I'm not even in your program. And so I think those things, just kind of embodying that kind of space where people might feel more, comfortable sharing these kinds of things would be, I think, some initial thinkings,
So if I'm hearing you correctly, you're essentially saying create a small safe space. Is that what I heard you say? Yeah, that's what I heard you say. Like, be intentional about creating this small safe space. Like, be intentional about it, right? Because that's what Alex has said. That's what Nikki has said, and you're reaffirming that. Like, hey, in this space, think about us, because we see that shows up for us. Yeah, beautiful. Shalane, did you have something to add, or?
I think just giving that, again, the clinician perspective in terms of creating the safe space. I think it goes to some of the things that have already been said. And I think just being able to see the client's individual differences and being careful not to label somebody or to make assumptions and stereotype them as being in a particular group. Again, like we were saying about, working with a Black client, for instance, not assuming that, okay, they are African-American when they could be, identified maybe as more, as Latinx or, Nigerian or whatnot. And so for one, at least being able to create a space where you're showing that you're willing to acknowledge their differences and be interested and invested in learning about those differences, as well as being able to see how, I'm trying to phrase this in my mind. I think going to what you were saying earlier, or even your experiences, Darlene, in regard to or your focus of racial trauma, for instance, and how that's something that can often get overlooked because it may not fit the, the typical definition of trauma. So if we're not allowing ourselves to be able to see, recognize those individual experiences within our clients, the people that we work with, then we may miss out and on ways in which we can help them if we're not creating this sense of openness and willingness to see who they are as a process of creating this safe space.
Yeah. And so given what you just shared, what tidbit, right? Just kind of same along the same lines I asked Waylon. what would you say to your colleagues, to training directors, to those who are involved in the training and support and development of the clinician? What would you say to them? What would be the recommendation?
Yeah.
I know. I asked for a lot, didn't I?
I mean, yeah, what comes to mind is it's some things that are very I would think are very basic, but I don't want
Yeah,
to know like how much they're actually occurring. I mean, we're
they're
just
not.
simply getting into like multicultural, type of training and whatnot.
Yeah.
But I think one thing that I've wanted to see even happen at my own program is being able to bring like some outside perspectives and not just what we're being taught maybe by faculty, but being able to hear it from like professionals who maybe have this particular focus, or groups or whatnot, just being able to bring more voices, just so we can hear some more
Mm.
perspectives. So
Mhm.
just we're getting from more sources, because I think not to say that maybe what even at my program that hasn't been good, but just I would like more.
Yeah.
And I imagine that could be the case across the board for other institutions.
Yeah. And even focus it in more on the clinical experience, right? So you mentioned the multicultural diversity class, and I gave a little stab at it. I did, because I think they're so lacking. Let's just be honest. If we're honest about the training that happens in culture, around culture and diversity, it's just not in psychology or mental health. It's education. It covers the gamut. If you look at many of the courses on culture diversity, and even of the community trainings, right? We can literally look at all of them, and they all seem carbon copy to me. Like somebody pulled out some learning objectives. They gave you some awareness information about the various cultures. They hardly ever talk about discrimination or racism, meaning, and I point that out because that is the action of engaging in bias around these particular differences, right? Like that is the thing that could really move us and shift us in this way, but we don't do that. Mostly, I believe it's because it has to do with the comfort level, right? Like we don't want to
Yes,
make
definitely.
anybody uncomfortable.
Right.
Except what's happening is we're leaving our clinicians unprepared.
Right.
As a person who lives this experience, obviously, that's how many of us end up being the persons who are facilitating the talks in grad school because we lived it, right? But it's really difficult to have those different trainings or have those like I don't recall getting anything extra around culture diversity in my particular program specific to race and ethnicity. Now, obviously, I went and learned more and expanded my understanding around sexual orientation, around gender identity. Like that was something that I did grow and develop. But Olani K, who's a specialist in this area, right? This is her expertise. Like I was learning stuff from her. I was like, oh, I didn't know there were models and things like that, right? Like I didn't know any of that stuff. Why? Who knows? Because once you learn that there are different races and ethnicities, it's like, okay, we're done. We're fine. We know what we need to know now. Now we can move on, right? No. We're lacking in that space because that's where our clients are coming in. That's where the research, like when you're doing research and you're trying to interpret data, that's where we're missing. That's where there are gaps because we don't fully have an understanding of lived experiences. So thank you, Jelani, for that. I want to bring it back around to Alex because we're over our time a little bit, but we have a little bit of cushion. I would like to ask Alex, if you wouldn't mind, similar to the question I asked Waylin and Jelani, what would you recommend, given the space that you sit in, the representation that you hold on this panel? What would be your recommendations, right? What would you suggest?
For clinicians?
I guess it would be for the clinicians, right? I guess it would be, yeah. And even the larger community, right? On just an interpersonal, creating safe spaces, just in general, right? You have a number of lenses, so just go at it.
I think that as one human being, every single person on this planet has an incredible amount of power to make any person within their radius feel safe. And I think the most powerful thing you can do is make some time to examine your biases, examine what it is that you want for other people on this earth, and then try to embody that. And when you do that, you just harness this beautiful power of compassion, and you can extend that compassion to every single person you meet and accept them exactly for who they are. And I would challenge clinicians to do that, to stop looking at people as a list of symptoms in the DSM and stop just automatically formulating a list of evidence-based practices to give to them. We want the evidence-based, we do, because it works, but we also as patients want you to look at us as a whole person. And sometimes our culture may not be compatible with one thing, or it may be better served by something else. Maybe for me, when you're addressing my trauma, I can't do prolonged exposure, but I can utilize DBT. You know, so it's just looking at us as a whole rather than as a number or a listicle of symptoms.
And if I could, oh, absolutely. Yes.
I just want to, I mean, I thought that what you said, Alex, was just so powerful and so poignant. And it actually, recently I've been reading a bit on Carl Rogers, and actually, and he even makes a point of something similar, and how we really need to, like, instead of seeing clients as like a set of symptoms and you know, some sort of task to be able to solve or whatnot, or puzzle to put together, like being able to see them for the person who they are, really, and you know, just this person-centered, you know, client-centered like perspective. I think so that we can see them as a human being first and foremost, and seeing them and being able to provide that compassion to exactly what you're saying, Alexander. So I thought that was really a great point to bring up, and just wanted to share that. Yeah, I really vibe with that, and so does Carl Rogers.
Wait, Lynn, you're nodding. You got something to add?
Yes. I think I was thinking of a couple of different things as they were talking. I think one is kind of that ongoing active and intentional nature that we've been talking about, right? Where every session or conversation or intake that you do with somebody, that you're reflecting afterwards, before, during the conversation, and not just looking at the symptoms, as Alex was saying, right? But kind of the various intersecting pieces of identity or the systems or society at large that's kind of contributing to that picture. And so I think it's holding space for that. And I think, as Jelani was saying too, with the Carl Rogers, it was making me think of the idea of being genuine.
Yes.
When you're in that room with the person, just being genuine and having genuine and open dialogue with the person that is in front of you.
Yes. And to the point of the biases, and this is why, to Alex's point, what you're asking and requesting of clinicians is to really examine those biases, is because honestly, that's the barrier that gets in the way of you being genuine, like genuinely present with your client. Like I often talk about this, like in the past few times that I've supervised and, you know, worked with like budding clinicians and whatnot, I often explain the expectation of the client is not for you to know everything. They need you to know what you're supposed to know, but they also need you to be present. And your skill set comes in being able to do both. That's really what it is. And as a heavily trained CBT person, I do know that from clinician to clinician, I know that that really puts us in a place where we do have to do a little bit of adapting, right? Because we know that those manuals are those manuals, right? Like you're going through. And so what then I say to the clinician is utilize what Waylon said, right? It's like, okay, if I'm going from session to session and I'm reflecting on, then that is where I get to insert the space to really be genuine in that next session. No perfection is required here. Nobody expects you to know about every African culture out there, every nuance that is the African-American experience, that is not the expectation. But that second part of what I said, your ability to be present with your client, that there. You can obtain that without knowing. And that's why I say the cultural diversity courses like do a disservice, because like it gives this false like space of like I'm prepared because I know about all the different races there are, except it doesn't allow you to be genuine, like genuinely present and curious, right? Because it's the curiosity. Because the curiosity just opens you up from, okay, I got to know everything. At least that's my lived experience as a clinician. When I became curious, and as a perfectionist and an overthinker, I let myself go from having to know everything because I was with them. And then, as skilled as I am in my manuals, it was still right there. They never go anywhere. Once that's drilled into you, it doesn't go anywhere, right? So if you think about how the mind works, that'll just pop up. But that being in the moment, that connection, that curiosity, that being very present, that's something you got to work at, right? So force yourself to be uncomfortable, clinicians. I don't care how many years you've been doing this. 5 years, 7 years. You know, once you get out of grad school, you're still uncomfortable. But, you know, after you've been doing it a while, you're like, yeah, I got this. No. Just get back on the bike. Fall a little bit. Get back up. Scrape your knee. You know, get out there. Be uncomfortable for your clients. That's what they're asking. All right. So, Nikkei, I would like to close because one of the things I feel like we've gotten a lot of action items and experiences that have really spoken directly to some of the barriers, some of the challenges, some of the things that you've experienced, some opportunities for growth, right? Some fine-tuned, pinpointed areas of like insertion of actionable things, right? Nikkei, you have the institutional lens. And of all things, I feel like yours is like the biggest elephant in the room, right? Because, you know, educational institutions. Waylon gave an example of how they're incorporating that advocacy piece. Like, that's amazing. That's an institutional change that's going to have very individual outcomes, right? It's going to impact individuals. Sure. And we talked from Alex's sharing, you know, Jelani shared about how, you know, those two as the clinical space can best be adapted and advanced, right? But institutionally, what does that look like?
Yeah, I think there isn't enough of exploration around the injustice and inequity that's baked into our institutions. And again, that's not comfortable. We don't want to go digging for problems, especially the kinds of problems that we don't feel equipped to deal with once they come up. The kinds of problems that can be really harmful and destructive if they're not managed well. But in order to move forward in a way that's going to be create environments and institutions that work for everyone, that's what you have to do. Because if you're not looking, if you're not exploring and asking the hard questions about who's been historically included versus historically excluded, what are our policies and practices, and what do we assume when we say certain things, where have we left room for our socialization and our biases to just inform our decision making. If we're not looking and asking all of those questions, then you can take it to the bank that inequity is running on autopilot in your institutions. And I don't need to do a research study. I don't need to complete an analysis. I mean, we do it, but like we're going to find stuff, right? So what institutions have to do that are really prioritizing equity is do some learning, do some awareness building, do some exploration, figure out why you need to do this DEI thing in the first place. It's not just speaking to the moment, it's speaking to everything that has brought you to where you are today. And then starting to address those things that you find. But it does require you to be willing to be uncomfortable. It requires you to be willing to grow with the people that are in that institution with you. It requires being able to be vulnerable and not knowing. It does not matter what power position you're in. You have to be able to go through that journey together. Otherwise, it's not really going to be effective. So, you know, there's a saying that I heard recently that I think is really relevant here, and it's nothing for us without us. Right. And so what I try to help folks understand is when you're doing this exploration, when you're doing the analysis and the assessment, when you're figuring out what you found and what it means, when you're coming up with the policies that you want to change and how you want to change it, when you're making all those decisions and going through that work, who's in the room with you? Is it just the people that have positional power? Because if you have to do this DEI work, more than likely the people that have positional power are not the for us, right? Nothing for us without us. And so you're going to have to broaden that and let go of our conceptions about, our ideas of who gets to make decisions in our institutions. You're going to have to do that honoring and listening that Alex talked about at the beginning of this, because that's the other thing that can happen, right? We perform a collaborative process and we're not really listening or honoring what we're learning from the folks that we are saying that we want to be more inclusive of. So nothing for us without us, I think is a really quick just sort of phrase that folks might be able to take with you. And then the other thing that I try to tell people is to think about each versus all, right? Because of our socialization and the folks that we automatically think is the standard, which is typically white, male, cishet in America, right? When we just generalize and go, well, this should work for all of us. This is great for all of us. All of us is actually just that profile. But when we start thinking about this should work for each of us, I mean, even the language alone makes you stop and go, okay, each of us, right? So that can also be a helpful thing to think about and to introduce into conversations about institutional change. And the last thing that I'll say is DEI change work is really a combination of psychology, organizational development and design, change management and leadership, communication, all these different things that we're used to doing as institutions, all comes together in DEI work. And so if you're doing this work to evolve educational institutions and workplaces, practices, etc., it's really important that you honor this work because it's actually like 5 different fields in one. And a lot of people miss that. And so they move forward, they try things, it fails, it doesn't work. And then, they create more harm or they just quit altogether. So.
Yep. And I think, so there was a question that came up that unfortunately we won't have time to deal with it or address it. And I'm going to share it with you, but I just want to give context to it because the conversation about allyship versus white savior is like a whole nother segment because it's so nuanced. And I hope that's what you take away from this, that in the face of creating safe spaces, in the face of wanting to be inclusive, because that's what our first roundtable was about. Representation in IOCDF community was our first talk. Because one of the things we have here in IOCDF is it's this beautiful, diverse experience where they have intentionally in the conferences included various groups, right? And we have excelled in certain areas and we're still kind of stagnant in others. And that was also, so I, again, recommend that you watch that other diversity roundtable because we spoke specifically to that. But that particular thing around allyship versus white saviorism is a whole topic. So I wanted to bring that forward because I saw you, I heard you. It's just so nuanced that is not something we can cover in the context of this without it shifting to a whole nother space. But I'm open to hearing if anyone had any recommendations for this particular listener or viewer. If not, again, we can follow up with you if you want to leave your contact information and we can reach out to you and give you some resources for that. But I wanted to bring that forward because our institutions are white-centered. We know that. We know that our institutions are white-centered. And we know that because of that, to your point about the language that you use about a profile, sometimes that automatically creates dissonance in what we consider to be safe spaces. And so to the point that you all have shared, it does become an intentionality thing, right? It becomes, let's be intentional about our own biases and how that informs our responses and our reactions and our approaches. But also, be intentional from a larger space as the person or the folks in the power spaces to seek to create nothing large or huge, to the point that Waylon made, like just having a space that says, even if nobody shows up, right? Because let me, this is a perfect example of how like this is different between allyship versus saviorism. What was your motivation for doing that? Did you want to get a pat on the back, or were you intentionally thinking about creating that space for them? If you are an ally, you're just going to create the space whether somebody shows up or not. But if you're looking to like, I just got to fix it, I got, then you got to be mindful of that, because that'll likely make you shift away from it because you didn't truly fully understand the significance of it. And so that comes with, again, being comfortable seeking that information out. How do you perform? How do you act in allyship, right? That is not performative, and what that means, right? So we can stay on here all night. We have absolutely gone above and beyond our time. But I want to say I thank you all for this very engaging conversation. It has warmed my heart. I would like to hear from each of you just on a closing point. And then from there, once everybody has spoken, I will close out and we'll, hope to see you all next time. So go ahead, you guys, close out. Closing points.
Something that I'll add, actually, is going from what Olenike was saying about that nothing for us without us. I think also when it comes to research within, specifically within the OCD community and whatnot, of being able to include more diverse backgrounds and whatnot in that research, because otherwise it's not very representative of all those who are suffering from these disorders and whatnot. So I think that's going to be a big thing moving forward, is making sure that within the research that we're including more diverse backgrounds. And I'm not just talking about race, but sexual orientation, gender, religion, so on and so forth. So
yeah, excellent point. Thank you, Jelani, and thank you for being here. Great feedback, great contribution. Thank you.
I think if you're ever wondering whether you're doing allyship right, or whether you're doing cultural sensitivity right, or whether you're actually walking the walk, as Dr. Davis was saying, and being an action-oriented person, a good litmus is, am I learning as much as I am putting out or speaking? Am I learning from my clients? Am I learning from these people I work with? Am I learning from the person who sits across from me? Excellent. And if you're learning, that should be good.
Say #winning, right? That's how you know you're winning. That's how you know you're doing it right. Because if nothing else, right, it puts you at least in a space of being open to receive, right? Because it is a direction thing, right? If you're centering your perspective, your needs, there's no way you only got 2 hands. So there's no way you're going to receive this information if you're giving it out. Again, I don't know how I'm doing this, but that might also lead us into the difference between allyship and white saviorism. I'm just doing it. I don't even know how I'm doing it. All right. Thank you, Alex. Thank you for being on this panel. Oh my God. I hope to definitely see you again. You're amazing. All right.
Second that. Everybody's been amazing. We talked about power today in a lot of different ways, even when we didn't explicitly say the word power or label it as such. And so I just wanted to end on that, like always being mindful of positional power and what power people are assigned. That aside, but also shifting from those traditional ways of thinking about power to just an understanding that we all have power. And starting from that place. So whether it's in a relationship with a caregiver, whether it's institutional in the sense of like the educational institutions, or in colleagues or foundations, like groups of people that are doing something together, like whatever those communities are, coming from a starting point of we all have power, and using that as a foundation to build whatever this work is on top of, I think is something really important. And it's important to continue to check yourselves on how your institutions are addressing or not addressing power, your relationship with power, how power dynamics play out. Because, you know, a lot of the stuff that's happening when you talk about DEI is very much rooted in power.
Yeah.
And all the things that are tied to it and the feelings that people have about it and how much people want it or don't want it, you know. So, when you're talking about creating a safe space, it's really important to think about power dynamics in that work as well.
Very important. Very, very important piece. And this word is triggering for some, but I'm going to say it anyway. I'm going to say it. Privilege. Ah! I'm going to say it, right? Because as a whole Black woman, I have a ton of privilege. I carry just as many little daggers that come my way, but man, I'm a whole clinical psychologist who had the privilege to go to school, and, you know, I have socioeconomic privilege, and so I know it's a triggering word for many people, but that power, that conversation, that point that Olanike made about your power, right? If you are intentional, if you are serious about creating these safe spaces, you will acknowledge the power dynamic and the privilege you individually bring into a space, because that should help you silence yourself. Right? Because as Alex said,
and
if it's going this way, there you go. If it's going this way and you are typically the person in power, you can't learn anything because your mind won't even allow you. Like, it has told you, hey, you know everything. You're in power. Shut it off. That's how you do that. All right, last one, Lynn, you're taking it out. Taking it out. Let's go, girl.
Well, I think I would echo kind of what everyone said. And I think to your last point, too, where there's almost this kind of like dialectical way of balancing these various experiences we hold, where one can both feel and be oppressed and also have areas of privilege, right? And kind of understanding that about yourself and where it comes out and making sense of it and relating to it.
Yes.
I think from the perspective of learning, kind of what Alex was saying, I think that word learning also came to mind as I was kind of like thinking about this panel that we had today. And I think in the beginning, we kind of presented it as this sort of like educational talk that we were having and educating people and things like that. But I think, you know, even just being in this space, I feel like I've learned so much from various people, like all panelists, but then also, you know, in the comments, right? Like thinking more about kind of allyship versus white saviorism and how non-white people can also participate in that narrative too, right? And so I think various layers of learning kind of were at play in this kind of
Absolutely. Absolutely. Well said. Perfectly said. And you closed out nicely with, again, just the awareness of, right? Because everything you just described is like this internal awareness of self. That is asterisk, shooting stars, the part of the slide where it comes in and then it bursts open. That's it. That's it. Awareness, self-awareness. Awareness of your biases, of your privilege, of your power, of what's your motivators, right? Like, start there. You can go to all the cultural competency sessions and you can take all the classes. If you have no self-awareness, it falls on absolutely nothing. There is no soil to be tilled. There is no water to plant. It is falling on cement. So that's where we want you to start. That's it. So I couldn't have closed it better. Wow. Thank you all. Thank you all so very much for joining us. We are absolutely at the very, very, very end of the time we could have taken to do this. My panelists were amazing. You all were awesome. I want to now speak specifically to the viewers and the listeners. There are a couple things that are very important to this diversity roundtable, and that's a call to action. These are our action items. Okay. We gave y'all some tidbits throughout that's specific to creating a safe space. But I would really like to hear from you all. Lift your voice, share your story. I like to call these community collections. I want to collect all your stories, share your experiences with me. They're very, very helpful. And then our ideas for inclusivity, suggestions, recommendations. Tell us your thoughts. In what way can we in this space be more inclusive? And then, of course, show up for our next diversity roundtable. I would love to see you. Our next one is on Tuesday, September 24th at 6:00. And this one we'll be talking about advocacy. So we're going to be talking about specifically lifting every voice, because a number of you have said it. There's power in the individual. Okay. And so how do we get that, move that forward? Because it is literally, as Alice has said, it's a meeting between two people. That's starting. Right. And if you're like super Black Christian, right? It's like 3 people gathered in his name. You know, you're a church, right? That's literally what we're talking about here. I'm just sharing all my little tidbits with y'all. But yeah, so that's where I'll close. Thank you all again for coming. Hope to see you all at our next roundtable. Thank you again, panelists. You were amazing. I could not have done this without you. And then we'll close on that. Thank you all. Have a good night.